have experienced at least one incident of gender-based violence. Up next, we speak to Ramneek Ahluwalia from the Higher Education Health, Wellness and Development Center. Thank you so much for coming through and talking to me. So we were watching Julius Malema there addressing the Women's Day rally, and you have come to talk to me about these shocking statistics. What is it about the institutions of higher education that makes such shocking figures possible? They're a microcosm of society, aren't they?
Absolutely. I totally agree with you. And we can't afford to lose young lives. You know, death of Kansani 3 months back, we had Zolile died in Mangasutu University of Technology. And there are many more, you know, which probably we don't know, we're not aware of. There are many universities and TVETs in rural areas that we need to reach out to. So you're totally right. The statistics from Wits University, our own surveys. There's one survey in higher education that says as high as 62% of our students don't feel safe while being on campuses and are prone to gender-based violence. 10% of total rape in South Africa has been now recorded coming from universities. So these are shocking figures, and this definitely warrants us as higher education, universities and TVET colleges to look deeply into our infrastructure, into our safety mechanisms, into our systems and our policies around what needs to be done immediately in order to ensure that we protect these young lives.
But what is it about the space of higher education, universities? They are closed spaces, right, in the way that perhaps physically they are laid out in that, you know, it's sort of usually secluded from the rest of a city or a town. But it also includes people coming from different backgrounds, you know, boys and girls, young men and young women interacting there. The supervision, of course, you would say is slightly different from what it would be at home. Are those some of the factors that come into play, or is there something to be said for the way that, you know, universities approach these issues of patriarchy and what has now come to be known as rape culture?
When we come out of our, you know, when we go to university or a college, colleges start taking students from 15-year onwards, and universities start taking students from 17-year onwards. Very young age, you know, there's a middle teen, late teens. Now, this is an unbound freedom. You know, you get into residences, you're first exposed to sexual behaviors, you try to change multiple partners, and volatility of young people does come out quite in predominance when it comes to universities and colleges. High alcohol and drug abuse. You know, we've seen data like 35% of our students abuse drugs and alcohol every month to the level they did not know who they slept with or wore a condom. So the drugs and alcohol, you know, the unbound peer-to-peer influence of having alcohol. One of the latest WHO studies says 65% of gender-based violence is preceded by drugs and alcohol. So the culture of drugs and alcohol, transactional sex. Lots of students from very poor, disadvantaged families have now begun to make courage out into universities and colleges. They get prone to transactional sex. Older men and transactional sex is prone to gender-based violence. So there are many more trigger factors that becomes much more vulnerable when you come into a university and college. And you know, these factors that exist in our communities, exist in our society, sometimes this unbound freedom, sometimes this environment of very uneven, people having cell phones and some students who cannot even afford a cell phone. Differences within the same environment, our own infrastructure at times, academics, sex for marks at times, you know, everything becomes pronounced for a very young child or young student between the age of 15 and 19 when entering into a college or university.
So is it possible then, Doc, to talk about the response and understanding of these issues of these higher education institutions, or do the experiences vary in as far as these institutions are concerned, the extent to which they understand these issues? Rhodes University is being criticized for, you remember when the students were marching and saying, hey, let's deal with the rape culture in this institution, and subsequent to that we saw some students being suspended, action being taken against them. Is that indicative of institutions' understanding of these dynamics and also the policies that they then put in place?
Tira, you're totally right. Now, we looked at the literature since 1970 now, And now, since 2016, the Ministry of Higher Education, the Department of Higher Education, all the vice chancellors, all the TVET rectors have now acknowledged that there needs to be a policy which is on gender-based violence. And this is going to be probably the first African policy that ever comes out from higher education and training. Now, it's not just a document that will be a policy. This will be a document that will mainstream gender-based violence within the institutions of higher learning. It will force the councils, the senior management to invest into gender-based violence. Investment in forms of safer campus audits. Investment in the form of developing disciplinary tribunals. I believe the civil action must take first at a university and a college level before a security cluster comes in. And that can be possible. We need to capacitate our institutions to develop campus by campus, not university by. Northwest is one university in Poch, but you've got 3 campuses. You've got a campus in Mafeking, which is far away from Poch. There's a campus in Wal. So we need to develop disciplinary tribunals at every campus level, capacitate them. Case to say, I think an immediate action has to happen immediately when girls report when gender-based violence incidents have happened, right from sexist remarks to fondling to as high as rape. Every sexual violence has to be dealt immediately and to be dealt with. Our first biggest reaction is, how do we put a comprehensive prevention plan for having new cases of gender-based violence? Do we have enough psychosocial support for our survivors of gender-based violence in the higher education institutions? Do we have post-exposure prophylaxis? Do we have oral contraceptions? We need to look at very comprehensive, holistic infrastructure approach.
If I'm not mistaken, you were part of the task team that was put together by government, the Department of Higher Education and Training in 2016. And coincidentally at the time, the man at the forefront of it all was Mduduzi Manana, who was back then the deputy minister. What has become of that work? Did the task team come back with a report, and how has it been received and processed both by government but also stakeholders in higher education and training?
So the Ministry of Higher Education, Department of Higher Education did constitute a technical task team. The technical task team is still working, and it's not like it's gone. It's absolutely working for the last 2 years. A large number of imbizos, dialogues and debates did take place at every campus level. A document has been developed which is called the Draft Policy and Strategic Framework for Higher Education Gender-Based Violence, which was one of the biggest deliverable of the technical task team. The policy framework has now been consulted across all the 26 universities, across all the 50 TVET colleges. It's now at a stage when it has to be gazetted by the cabinet, and it's at the last stages of its policy to be coming out. If it comes out, it does become Africa's first ever policy on gender-based violence. It does mainstream gender-based violence at its highest level in the institutions of higher learning. I must acknowledge that a lot of work has gone in the last 2 years, going into development of this policy framework, consultation of this policy framework, looking at what are the gaps in the infrastructure within our institutions of higher learning, right both in the rural universities, urban universities, TVET colleges, right in informal settlements, deep rural areas. So we had to look at a very comprehensive approach towards looking at every angle of what needs to be now put in place as a part of an implementation plan so that we can fight gender-based violence.
Just back to, diagnosis, and, we are so good at diagnosing things in South Africa to the point that sometimes we fail to move on to implementing things. But let's go back a step or two and talk about, attitudes that you see reflected in some of the articulations that you hear from time to time. So in response to the incident at Nelson Mandela Metropolitan University, Nelson Mandela University last week, it is reported that one of the student leaders was delivering an address on gender-based violence and said something to the effect that, if men and women would be separated, something to that effect, this would lead to sexual frustration, which contributes to rape on campus. There's also reports about, sometimes the response being, I've told you girls on campus to lock your doors. How prevalent is that? These kinds of attitudes, victim blaming, but also the cluelessness around issues to do with gender-based violence on campus, and also do they reflect what prevails in society?
It does. Our universities are not separate from societies. That's very true. And the most important part is, as per to lots of dialogues and discussions that we've had now with student communities and going campus by campus, there are many issues that have come out. The issues have been right in the front of campus security itself. The security personnel that are in charge of the campus, they sometimes seem to be perpetrators at times. It goes as far as simple things like bathroom latches. You know, somebody who has to monitor, does a sports complex bathroom latch where sometimes rape happens. Who monitors that? You know, there are simple things that we can put, lighting inside the campuses, drugs and alcohol within the residences. So there are multiple issues if you drill down into the data, into the evidence, and things that are coming from the bottom at the grassroots level, from peer-to-peer, from students' community. And it drills down, definitely. Like a data suggests that 28% of our females and 27% of males within higher education, even today, believe that a girl cannot refuse sex with a boyfriend or somebody you know. I mean, this kind of knowledge level needs to change. We need to still go and have massive peer-to-peer education programs. There might be time that we need to induce self-defense techniques now, and we're planning to put as part of our peer-to-peer education program, which is the second curriculum which happens every day in debates and dialogues in residences outside the classrooms, to teach young girls self-defense techniques. Probably it's important that we need to prevent new cases of gender-based violence. We need to go everything possible in order to ensure that our young students are safe within the higher education institution.
And isn't it tragic that we will then be focusing on women and teaching them self-defense when we are the problem as men? Thank you so much.
Absolutely.
Thank you for coming through. Dr. Ramneek Ahluwalia talking to us there about the situation in as far as the campuses are concerned, in as far as gender-based violence is concerned on campus.